Hi, I'm Dr. Vivekanandan. I'm a liver transplant surgeon at Global Hospitals, Chennai. Today, as part of the ongoing patients education program, I'm going to talk about hepatitis. Hepatitis is an inflammation of the liver where the liver swells and prevents the liver from functioning normally. There are various causes of hepatitis, and in our country, the most common is of viral etiology. The liver is a very resilient organ, and it normally would not complain until at least about 50% of the function is lost. So when you see symptoms of liver disease, please be aware that 50% of your function is already lost. As I said earlier, viral hepatitis is the most common cause of hepatitis in our country, and about 5 different types of viruses which can affect the liver. They are hepatitis A, B, C, D, and E. The routes of transmissions are different, and what they cause to the human body is also different. For instance, hepatitis A and hepatitis E are transmitted by the fecal-oral route. When I mean fecal-oral route, it means it comes by contaminated water and contaminated food. So if we drink water that has got hepatitis A or E infested in it, then our liver will be affected. Fortunately, hepatitis A and hepatitis E are self-limiting. When I say self-limiting, if they normally are present in the liver for some time, and if the immunity in the human body is good, then in about 5 to 7 days time, the virus would disappear from the body, and there will be no long-lasting effect on the liver. But nevertheless, we have to be careful. All these things need to be tested and make sure proper treatment is given, which I'll come to a bit later. The most dreadful form of hepatitis is hepatitis B and hepatitis C, and hepatitis C more than hepatitis B. Why? Because the treatment for this is very limited. Fortunately today, hepatitis B has got some fantastic drugs, and we can completely cure the people of hepatitis B. But certainly hepatitis C do not have good drugs, and of course there's lots of research happening, and maybe in a few years' time we will have fantastic drugs to treat the hepatitis C. Both these forms of hepatitis B and C are transmitted through blood and exchange of body fluids. So how they are transmitted? They are like improper. They're transmitted through tattooing, through blood transfusion, through sharing of needles and sharing of razors and scissors, unprotected sex, multi-sex partners, and through surgeries, unwanted surgeries which are infected with this hepatitis B and C viruses. So what are the symptoms of hepatitis? The hepatitis, normally, as I said earlier, the liver is very resilient and normally would not complain, and they generally start like with lethargy, malaise, someone feeling very weak, flu-like symptoms. They might have distaste to food, a bit of vomiting, general body ache, and a mild temperature. And during a very late stage, they start developing jaundice. And once jaundice develops, we have to be alarmed, because more than half of the function is lost, and the liver is swollen so much that it prevents the bilirubin from draining out of the liver into the intestines. So these are the most common symptoms. Very rarely, in very severe forms, patients can go into coma, what we call hepatic coma, and at this stage the patient need to get admitted into hospital. So how do we detect hepatitis? There are very common blood tests which are available. First, we have to do a liver function test, which will tell us as to what is happening to the bilirubin. There's other parameters called SGOT and SGPT, which will tell us as to what is happening with the liver cells, and if they are very high, it means that the liver is certainly inflamed. INR is another marker of blood coagulation, and when this is raised, it means that there is a serious dysfunction in the liver. An ultrasound or a CT scan will just show an inflammation of the liver, but certainly will also show whether there's an underlying liver disease, whether the liver is shrunken, whether there's fluid accumulation in the liver, and so on and so forth. So treatment for hepatitis, I'm going to divide that into medical and surgical treatment. Fortunately, hepatitis A and E, as I said, are self-limiting, and even if we don't do anything, they would normally settle down if they are in a very milder form. Obviously, a severe form needs some form of treatment. I would emphasize on one point here that please do not go for any native medicines, because native medicines are not proven to treat hepatitis, and they are only going to damage your liver and cause very more harm. So please do not go for native medicines. In case you fear that you've got jaundice, then please see a doctor who will do all the blood tests and will give all the necessary medications. As I said, the medications are only supportive medications. The liver needs some rest and some support, and normally it is self-limiting and it will normally settle down by itself. Gone are those days when there were dietary restrictions, salt restriction and fluid restrictions and oil restriction. So what we advise patients these days is have a very high protein, good quality meat and clean food during the phase when your liver is affected. This is in general for all the hepatitis. In specific for hepatitis B and C, there are particular drugs that are available. Once detected, it is empiric that you see a doctor who can institute these drugs and prevent long-term damage to the liver. What is important is, once we get hepatitis B and C, the patient should be on long-term surveillance, and definitely an annual blood test and an ultrasound scan is imperative, so that we detect any complications, because they can cause complications even 10 years or 15 years later. Surgical treatment, in very, very rare cases, these patients can go on for complete liver failure. As I said, hepatitis A and E can cause what we call acute liver failure, where the liver was completely normal until a few days ago, and because of the hepatitis, it's completely dysfunctional now, and the only way that one can survive is to change the liver and give him a new liver. As I said, hepatitis B and C can cause chronic liver disease, and when I say chronic liver disease, they enter into a stage called cirrhosis of the liver, where the liver shrinks down and they have complications of cirrhosis. What are the complications of cirrhosis? One can vomit blood, they can have swelling of the tummy, ascites, they can have coma, hepatic coma, they can have swelling of the legs, and so on and so forth. And in the long-standing cases, they can also form cancers of the liver. And that is why, again, I'm telling you that once detected with hepatitis B and C, they have to be treated, and they have to be on a surveillance with a doctor, with an annual blood test and an ultrasound scan to detect any complication that is going to happen very early. Last but not the least, prevention is the best form of treatment. So please prevent from you getting hepatitis. The common forms of prevention are: make sure you drink clean water, make sure you eat clean food, and it's no harm in spending 20 rupees on a bottle of water and making sure you get clean water rather than drinking in some place. Make sure you get clean food and hygienic food for you to prevent hepatitis A or E, so that you prevent plenty of money on the treatment which would follow in case you're affected with hepatitis A or E. Hepatitis B and E, as I said earlier, prevent sharing of needles. Make sure your doctor uses disposable needles all the time, and make sure you don't have unprotected sex, or make sure you don't have multiple sexual partners. Please do not have tattoos, because they can transmit hepatitis. Blood transfusion, of late good labs do test bloods today. Make sure it's not laden with hepatitis B and C, but there is always a small window period where whatever testing you do that you can miss. But be assured that the doctors make sure that it is not transmitted by hepatitis B and C. And please do not share personal items like scissors, razors, or blade. And last but not the least, vaccination is very, very important. Today, there are vaccines available for hepatitis A, hepatitis B. Please have your vaccines and prevent from you getting hepatitis B. Today, as a fact, that 5 lakh people die every day in India because of hepatitis. Make sure you're not one among them. Make sure you get tested. Thank you.